What I'm looking for is the movement of the spine, the rhythm in which he bends forward and bends backward, and whether there's a break in that normal change in alignment. Again, we're looking for gross abnormalities, and I am not interested in the range of movement. Measuring the distance from his fingertips to the floor really doesn't add anything to a first-time examination. Having assessed flexion, I also want to make sure whether or not this brings on his pain. So my question to the patient is, as you bend forward, do you feel your typical pain? The pain that we were talking about a few minutes ago when I took your history. So bend forward again. I'm looking at rhythm, and I am listening for reproduction of typical pain. I do the same thing in extension. It's important here that I don't splint the low back. Put your hands on your buttocks and arch backward, look up at the ceiling. And again, I am looking at the movement in the lower lumbar spine as the patient arches backward, and I am questioning about reproduction of the typical pain. Other spine movements can be assessed. Rotation, for example, just simply twisting the back and seeing how much it hurts or doesn't hurt to rotate. These are movements best done when the history suggests there's a problem or if I'm trying to assess his ability to function. But in terms of simple pattern recognition, it's flexion and extension.